Empowerment Show aims to equip individuals with the necessary tools, knowledge, and confidence to make informed decisions and take control of their lives. It also focuses on ensuring access to essential resources and the opportunities.
Hello, happy Monday, everyone, and welcome to Mental Health Mondays. I'm your host. My name is Hope. That's why it's Mental Health Mondays with Hope. So today, our guest is Scott Reese. He is an RN, and the topic is NIMBY, not in my backyard. But before we get into all of that, welcome, Scott.
Thank you, Hope. I appreciate it.
Yes, yes. So I always like to start the show off with a positive affirmation with my guests. And I ask them to say something positive about themselves after following the words I am. So what can you tell us about you?
I am healthy enough at this point in my life that I can help others. And that's what I strive for in the field that I work in and what I do with every aspect of my life.
That's great. That's great. That's wonderful. And I always have like a little bit of a tagline also, because you think about having conversations with friends, because that's really kind of how Mental Health Mondays goes. It's kind of like having conversations, and you're thinking about, sitting down in the living room on the sofa and getting yourself all comfortable so you can have your conversation. Well, the conversations we talk about or we have, or the topics we talk about, are not always easy topics. So instead of getting comfortable, I like to say, let's get uncomfortable. So, Scott, tell us about your nursing career. What do you do in nursing?
Well, believe it or not, I never wanted to be a nurse. I never had any aspirations. It just it kind of happened that I found a niche and didn't realize there was psychiatric nurses, and I didn't realize I can contribute in the way that I do, based on the path that I took in life. I originally set out to be a teacher. That was my game plan. I wanted to be a weatherman first, but I couldn't hack the math, so I went out to be a teacher. And as soon as I got into mental health, I knew it was the right fit for me. I knew this is what I needed to be doing. I just needed to find out where I fit. So
Okay.
I went through my own path, and I grew into the field. I started off, basically as low as you start off. I was a residential care worker. I worked with at-risk youth, 12 to 20 years old, in the juvenile justice and children and youth services system. I got to learn a lot about kids from very diverse backgrounds, things that I never would have seen, growing up where I was from. And as I moved through my career, I eventually became a teacher. I was teaching those same kids in an alternative learning setting based on the education that I had. And I took a chance and applied to a hospital, and it was a mental health tech position. I didn't know much about it, but it sounded like something that I would be good at. And I took to it like a fish to water. As soon as I started there, within 3 months, I worked with a lot of wonderful coworkers, and a couple of my coworkers had applied to nursing school. And I looked around and I saw, I'm like, wow, there's not only is there a lot of, positive role models and positive nurses and techs here, there's a lot of male nurses here. Didn't know that was a thing. Honestly, I never really saw male nurses. We're only about 7 to 9% of the population.
Right.
So I saw, like, what, they really seem to be in demand in this field. And I applied to nursing school, expecting to get waitlisted, by the way, which is what I was told was going to happen, because it happened to some of my other coworkers. We had 288 people apply. Wow. And 75 spots. And I wound up getting a letter back, and it was like, yeah, you're going to nursing school.
Congratulations. Thank you. Now, did you go straight, like you went for your RN immediately?
Yeah, I didn't really have any ambition to be an LPN. I figured, the RN or bus. That's what it's what I wanted to do. My at the time, my girlfriend, she wasn't an RN. She got her license 2 years prior, and she kind of pushed me into this idea that maybe you could do this. And I was like, yeah, maybe I can. We'll give it a shot. And I already had a pretty solid background. I had 2 degrees, liberal arts and social science. And then I went for my undergrad. So I was 2 classes away from finishing at Muhlenberg for history secondary ed. So I had a whole life, path in place, but a
Right.
lot of those classes applied right to my field. So I was able to take the TEAS exam. I scored very well, believe it or not. It was 7 years since I'd been in school, and I didn't even have all my prereqs in Hope. I like literally was missing 3 classes, and they're just
Wow.
like, I was as surprised as anybody. I got the letter, and I was like, well, I guess we're doing this.
Nice. Now, were you going to teach history? Is that what you wanted to teach?
The
If you
plan
were
was
going to teach?
secondary ed history. That was my game plan. Eventually, I wanted to teach at a college. I was looking to, be like a professor at some point, but life took me a different direction.
Right, right. Have you ever thought
Definitely.
about teaching nursing?
Well, that's exactly what I was planning on doing when COVID happened. Unfortunately, I was registered at Western Governors. I was ready to go. I was going to be a clinical instructor.
Okay.
That was my game plan. I was all set. I was in the RN to MSN bridge program. And when COVID happened, my kids got sent home from school, and
Mm,
it was very difficult. So it didn't seem like the right time to go to school. Plus, we all had to work 60-hour weeks. It was a lot.
right, right. Now, you said that originally you wanted to be a weatherman,
I did.
but you
And
are kind of a weatherman, aren't you?
I am. Yep, I'm a content creator on Facebook. NEPA Storm Chasers. I have
Yep.
68,000 followers, and all
NEPA
across.
Storm Chasers, ladies and gents. Go ahead and give them a like.
Absolutely, a lot of people across Northeast Pennsylvania know me, and they love the content we put out there, and we in a way, I mean, I can tie in a lot of what I do as a nurse into weather forecasting, because it really is about keeping people safe. It's really about protecting
Okay.
people and informing them so they're prepared, not afraid. Because a lot of people get afraid of the weather, and you gotta introduce these ideas that it's going to be okay, but you just have to plan,
Right.
like anything else, you have to make the right preparations so you know what to expect.
But and it's a fear of the unknown,
For sure. Everyone
and
is
that
terrified of that. Absolutely.
right,
Driving in snow, severe weather,
right.
it causes people so much anxiety. I swear I spend more time therapy with my followers than I do forecasting, because I get a lot of
Right.
messages.
Right. But like you said, tying it to nursing,
Yeah,
it's the fear of the unknown. And
yeah,
we'll tie that into what we're talking about, what
100%.
we're talking about today. So what are you doing in nursing right now?
So I decided to go a different route. I had done acute inpatient psych for a long time. I also did older adult psych for a period of time. For a little bit there, I decided I was going to go back into pediatrics. I was gonna be a children's psych nurse. I think that time has passed, so I didn't really like it. Like I didn't have the same drive that I had when I was younger, and a lot of things have changed. So I decided, like, let's do something different. I was a travel nurse for a short period of time, and then I realized I really need to lay roots, because I don't like I don't like bouncing around.
Right.
I don't like being in between things. So I found a job. I actually found 2 jobs. I actually got hired 2 days apart for 2 different
Oh,
jobs. They're
wow.
totally different things that I had ever done. One was drug and alcohol. I've dealt with drug and alcohol throughout my career in every psych job that I've had over the 16 years that I've been in the field, but this is the first time I was in a drug and alcohol detox and rehab.
Okay.
It is the most incredible environment I've ever worked in, with some of the most incredible, and I'm not taking anything away from the people that I worked with before, but the healing that we see is unlike what I saw when I worked in the hospitals.
Wow.
And I'm very happy to do that. And then on the side, my side gig, I do home health nursing, which I didn't know there was home health psych nursing. Guess what? There is.
Right. Right.
So
That's
I learned,
awesome.
yeah, I learned that something that I used to talk about, and you may even remember me talking about this when we worked together. I really never understood why there wasn't more outreach into the community from when you from the hospital to try to prevent readmission, and that's what I do now. So that's my
Right.
second
That's
job.
excellent. Yes. Yeah, that's tremendous. I know I work in hospice, and we have utilized psych nurses every now and again. But yeah, I was checking into seeing if there was like traveling social workers, but
They
but
they,
like you,
they
I don't.
do.
What's that?
It does exist.
I know. I don't want to do the traveling like you said.
Nope,
You know,
nope.
I like to stay local.
Like they say, you can't have roots and have wings. It's difficult.
Exactly. No, you're right. Oh my gosh, that's so true. That is so true. I've
Absolutely.
been thinking a lot about that lately. So we'll talk more about like where you work and all that and what have you as it integrates with with our topic. So the topic which you approached me and I thought it was great because you're very, very passionate is NIMBY. I love it. NIMBY, not in my backyard.
Absolutely.
Not in my backyard. So tell me, what does NIMBY mean to you?
You know, you hear a lot on the news, social media, you know, in the break room work, a lot of people, something bad happens in the world. You know, there's a school shooting or there's, you know, a mass casualty event, you know, any
Uh-oh, I think you froze on me.
bad things that happen that you see or hear about, and everyone always says, well, why didn't that person get help?
I keep losing you, Scott. Uh-oh. Does this mean I have to sing until Scott comes back or until Kendall comes back to rescue me?
Can you hear me now?
Oh, there you are.
I'm back. You back? Okay.
I am back. I'm back. You're moving now. You were frozen before. You were frozen. We're back.
I can hear you now. So can you hear me good?
Okay, good. Yes,
are
yes.
We
and
all
Kendall's
set? Are we back?
So the gang's all here.
Oh, great. We're all back. Okay, great.
Yes,
no more Walt Disney there. All right, we're good.
We're all back. No. So you were talking about when there's a situation, mass casualty or something bad goes on and the community. Go ahead. That's where we lost you.
Yeah, people always make this. You know, you hear this the same. You know, it's like a broken record. Like, why didn't that person get help? Why are there not more services? Why don't we value mental health in this country? Why do these things keep happening? Well, after you've worked in the field for a while and after you've been in these communities for a while, you start to learn that just because there is help out there doesn't mean it's available. It doesn't mean it's accessible. And it doesn't mean it's practical or affordable for people to actually go there. Like, for example, rehab can cost anywhere from $20,000 to $40,000. It's outrageous sometimes. And this is across the board, whether you're talking about rehab, whether you're talking about inpatient, outpatient, all of this is a matter of having the access. Not everyone has that. And unfortunately, people talk a good game about how they really care, so much about mental health. But when it actually comes down to putting a facility in your town, when it comes down to, I mean, I've literally listened to elected officials, council members talk about, if we do this, if we open up this facility, then you're going to see a flood of mentally ill people into our communities because they're going to be released and they're going to be our problem now. And the whole mindset is just twisted because you don't open a psych hospital, you don't open a Suboxone or a methadone clinic in a affluent neighborhood that has no issues with drugs and alcohol just so you could bring in people that are addicted to drugs and alcohol. That doesn't make sense. You make it portable for people that are struggling in those communities. The same communities that are having the same issues, that complained about those issues, are the ones that need these services, but nobody wants it there. It's the
nobody
same
wants
as, like,
it in their backyard.
Nobody wants a prison in their backyard. Why? Well, the criminals might escape. I mean, let's be real. If you're a prisoner and you escape from prison, you're probably not sticking around the place you escaped.
Right. But in this day and age, I mean, the neighbor decides to shoot their family. I mean, it's like you said, it's taking something because it's there and making it scary. The unknown is scary. The unknown is scary.
Every small town that I've lived in or that I've been around, at least nowadays, they're all dealing with drug addiction as one of the bigger problems. Meth, heroin, fentanyl, these things are horrible social problems, and they're not
Absolutely.
just mental health problems. They are, but they're also community issues. People breaking
Absolutely.
into homes, robbing people, breaking into cars, stealing copper pipes, all of these things that nobody wants.
Right.
But yet nobody's willing to do the things necessary to help these people. So what they do is they'll go in front of their board, they'll go in front of their council, their district whoever the governing bodies in play are, and they will protest. And
Right.
I've seen this happen time and time again where the clinic that needs to be there doesn't get opened.
Right.
Doesn't get open because nobody wants it there because they feel that this is going to create more problems, not understanding that those people battling that addiction, they're there anyway. They're not leaving. They're not going anywhere. They're in your backyard already. At least giving them somewhere to go, giving them somewhere to and I'm talking whether this is a clean needle exchange, whether it's a safe shoot up shelter, anything. If someone's going to shoot up, they're going to do this, whether it's in your backyard or they're going to do it somewhere safe where they don't have to
Right.
worry about it.
Right. And you know what? And this is where we get uncomfortable because it makes other people
Yep.
uncomfortable, not you and I. I would rather have somebody shooting up if they are doing that,
Absolutely.
if they are working through the process of, hopefully getting away from addiction. I'd
Yep.
rather do them have them do that in a safe, clean environment versus I was at a gas station the other day.
Yep.
And the attendant was taking the trash in, and luckily he saw that somebody threw their purse in the garbage because he picked the purse out, and had he
Yep.
not, he would have probably tied up the trash bag and got poked by a needle that was in the trash. So I would much rather have those needles in a clean, sterile, safe environment where people can then actually be watched, versus picking them up in the parking lot, seeing them out on the hiking trails. And everybody complains
For
about
sure.
seeing
And
them.
I mean,
Everyone complains about finding them,
yeah.
but it's the same people that
Yep.
complain about putting up a facility not in my backyard. So I get it.
Yeah,
I
and,
get
and
it.
it's a public health epidemic as well. On top of the mental health aspect, there's a public health aspect to this because people that do exchange dirty needles, they spread, STIs,
Right.
HIV. I mean, these things are very serious problems. And believe it or not, I mean, not everybody can identify who is a IV drug user
Right.
just because not everyone people mask this stuff very well. So
Absolutely.
if somebody could meet somebody at a bar not knowing this person's an IV drug user, and this person doesn't test for STIs. This person could
Right.
have God only knows what, and you won't even
Sure.
know it. And next thing you know, you have an outbreak of hepatitis or genital
Right.
herpes or HIV in your backyard.
Right, right. And I mean, the bar pickup is a little bit cliche, but that's one that people understand. But anybody and everybody is using drugs. And when I say that, what I mean is there's no stereotype. So it could be somebody that's in the park with their kids, and that's a single parent and you're a single parent and you meet in the park, because there's no stereotype really about people, concerning people who might be using drugs. So I know that we have a rehab facility in our county that was protested. I don't know if you want to call it. I mean, the people protested against its opening. I'm not saying they were waving flags and and signs and things like that, but there were plenty of hearings with plenty of people that came who were saying the exact same things, that there's going to be an influx of drug addicts hanging around. They're going to leave the facility and stay in our community. Well, if they're rehabilitated and they stay in the community, that's not a bad thing. But just speak a little bit more, because I'm sure since you work in that field, I'm sure you've heard stories of facilities being protested to be opened. And is there anything that you have found as the outcome when these facilities do open? Like what's the outcome? Drug addicts hanging around?
So
There
for
you
the
are.
most part, for the most part, a lot of the research that I have done, And that's what it comes down to, because again, there's so much hesitation in this area. I mean, in the Northeast United States in general, we lack sufficient services. But a good place to compare to would be the Pacific Northwest. The Pacific Northwest has a very similar issue with a very similar drug epidemic out there: meth, heroin, fentanyl, the same types of things that we deal with. And the research that I've done, and West Coast people are a lot different. They have a lot different mindset. There's a lot different speed, and they approach problems in a much different way in a lot of cases. So I have friends that live in Portland. I've done a lot of research of Dr. Gabor Mate. He's a psychiatrist and a physician, and a whole bunch of other letters behind his name. Out in the Vancouver, Seattle area, and from the research and from the firsthand experience from people that I know that live out there. So I'll give you a good example. Safe shoot-up shelters, they have them in places like Portland, Seattle, Vancouver, Surrey, those types of areas. To date, the last time I looked into this, there was never an overdose death in a safe shoot-up shelter in any of those states.
Wow.
They have doctors there, they have nurses there, they have people there to keep an eye on people to make sure that this doesn't happen. So
right.
just the fact that you can look at a situation like that and realize that every time someone does an overdose, that's another intervention, that's another opportunity
Absolutely.
for that person to turn their life around.
Right. And I think, the not in my backyard is there's a just a lack of knowledge.
Yep.
Am I still on? All right, cool. It's just a lack of knowledge, of the process. They're not going to put in a facility someplace without doing their homework. They're not going to just let people wander, knowing what their situations are. I mean, these are the professionals and these are the armchair quarterbacks.
Hope, the amount of people that I've heard in my life say, oh, someone's on Suboxone or someone's on methadone, they're just replacing one drug with another drug. I mean, really? No. Right. I mean, if you want to be as generic and say something like that, but in reality, that's not what's happening. Methadone, Suboxone, they are measured, they are pure, right. They are not tainted with other drugs, they're not laced with other substances, and they can be safely administered to people, and they can live a generally drug-free lifestyle for the rest of their life when taking these medications. And I'll tell you right now, if you're going to give me an option of someone getting potentially laced heroin or laced meth, and this person's going to die of a fentanyl overdose or have that risk, I'll take those drugs all day, every day. At least that person's living. At least that person has a chance. You have no chance when you're buying something off the street. What you're getting, you don't know. I work in the field of, you have to intervene. It's all about interventions, and every intervention is an opportunity, and that's how you have to look at it. Not everyone's ready, not everyone's here at that point, but just because somebody is obese and they become a type 2 diabetic, we don't say, well, you're not getting your insulin now because you know what, you did this to yourself, so you need to figure this out on your own. No, the same theories should apply to mental health and to addiction as apply to people in the hospital. You don't see somebody going to get stents put in or to get cardioversions done. Someone that suffered a heart attack. You don't see someone that, well, you know what, he ate pork rinds and McDonald's every day of his life. He got what he deserved. Right. You don't hear that same thing. People don't treat that the same way. And in reality, I mean, similar mechanism in the brain that's creating someone who's binge eating or binge drinking. It's really not a whole lot different, but the way that we stigmatize it is so much different.
Right, right. You just made the correlation between insulin and drug medications. So like Narcan, let's say. And you see these posts
Yep.
all over social media all the time. How is Narcan free? Yet, we are paying an arm and a leg for our insulin. You have any thoughts on that?
Yeah, my thoughts on that are, uh, do I think Narcan should be free? Yeah, I do. Do I think insulin should be free? Yeah, I do. I have the same energy. I have the same belief that medical medications should be affordable just as Narcan should be affordable. Either way, you're saving a life. Either way,
Right,
you're intervening in someone who's not able to do it themselves necessarily or that need that. If you're an EMT or if you're a first responder, you're not walking up to somebody and, pulling out their wallet and saying, "Oh, no, this person is a garbage man in his life. He's not worth saving. Oh, this guy's a doctor. He's definitely worth saving." We don't look at it that way.
right.
And you need to look at all drugs the same way. Life-saving drugs are life-saving drugs.
Right. And I mean, I absolutely agree with you. Do you feel that potentially the powers that be are perpetuating the stigma or dividing the people?
I do think that. I do because in this country you have compulsions that are socially acceptable,
Mm.
and nobody really talks bad about workaholics. I think workaholism is a horrible disease. People who are workaholics, they miss family.
Mhm.
They could be absent fathers, absent mothers. They could be not present as a spouse, husband, wife, whatever. You're looking at people that work themselves, to death basically because they overwork. You look
Right.
at people that are, that play on social media all day long.
Mm.
This can be something people might spend 8, 9, 10 hours a day on TikTok. The person that's doing drugs or that drinks every day of their life. And that's the
Right.
difference. Socially acceptable compulsions are one thing, but then addictions are another thing. It doesn't make sense.
Right.
It's the same mental,
Right.
it's the same issues mentally that you're battling with there. But one of them we say, we give a pass to one, but not the other. It just
Right.
doesn't. Sorry, it just doesn't make any sense.
Well, binge watching a series, oh, what should I binge watch next? And I mean, I almost got sucked
Yep.
into that. I mean, for like 14 hours, I watched Lucifer. And then, I mean, I stay
Yeah.
away from things like that because you can get sucked in. But I'm not the type to keep
Yep.
doing that, but it's acceptable. Oh, what'd you do this weekend? For 48 hours, you watched the whole entire series. But you're absolutely correct. It's interesting because I just had somebody say to me that as a sober person, it gets very frustrating when everything is centered around alcohol and
100%.
how people will actually say to them, "Oh, come on, it's just one drink." And again, alcohol, I mean, that's a serious addiction, and it's not taken as serious by society as much as it is the person who's addicted. Food being another one.
Alcohol causes more deaths than just about any other drug. I mean, cigarettes being obviously the most, but I mean, alcohol related deaths are, yeah, you're right, and you're right. If you refuse a drink, people either want to peer pressure you or they want answers.
Right.
Why is it that you're not,
Oh,
tell
right.
me
Yeah,
why
I
you don't
forgot
drink? Are
about
you are you
that.
are you
Yes. Right.
are you in
Yeah.
recovery? What's going on? Are you a Jehovah's Witness? What
Right.
what they're at? They ask all these uncomfortable questions. Maybe I just don't like to drink. Maybe I don't like to
Yeah.
wake up with a hangover. Maybe I just don't want to
Right.
feel that way. Maybe a sober oriented lifestyle brings me more happiness.
Absolutely. Absolutely. So we're going to take a quick little commercial break. No, we're going to keep going. Okay. We're going to keep going. We're going to wrap it up shortly, but we're going to keep going. So we've talked about, not in my backyard. We talked about the need for these services to be in our backyard. A friend of mine just sent me a picture of a mental health support group. It was hanging at her doctor's office, and the support group, however, was listed for down in Allentown, and this doctor's office was not in Allentown. It was in Monroe County, where where PA Empowerment Network is based, here in Monroe County, Pennsylvania.
Right.
And these people had no place. Like, how do you get there? It just seems like they didn't look at like you said earlier, is there a way to get there? Do they have the means to get there? The money,
Right.
for transportation. And so how can our healthcare providers do better? And how can we do better as members of the community?
I
Big,
mean,
big
for
question.
starters, we need to look at mental health and health as one and the same. And for those who don't know, I mean, if you don't work in the field or if you haven't experienced it yourself, you may not know this, but for example, if you are staying inpatient psych, or even if you're going to psych visits, you have a limited amount of time every year that your insurance company is willing to pay for it. Like, for example, you may only have 28 days on an inpatient psych unit. What if you need 60? What if you need 90? Well, the reality of the situation is you get pushed out. You get pushed out because you simply won't pay anymore, and then it becomes self-paying. People can't afford that.
Right.
When it comes to therapy, if you need physical therapy, they'll meet with you 3 times a week, weeks until you're rehabbed, and then you're good to go. I went through it with my knee surgery. I know how it works. But you don't see somebody getting 3 therapy sessions a week for 16 weeks for depression, which is something that people need. I'm sorry, one trip to the doctor, who might see you for 3 to 5 minutes every 2 weeks, maybe every month, it's not going to cut it. I mean, we are getting to the point where there is telehealth more available than it used to be, but it's not remotely close. The amount of money and the amount of funding, the amount of the budget for medical insurance goes strongly in the favor of medicine as opposed to mental health.
Absolutely.
And that's something that can change. If those walls can come down to the point where we acknowledge the fact that preventative medicine isn't all about eat the right food. Sometimes it's about get your mind right so you eat the right food. You have to be able to address, above the neck, not just below the neck, and it can't be looked at anymore like it's a whole different field. It doesn't work.
Right. Now, I know that, you are politically savvy, as am I. And there is supposed to be, there's supposed to be parity with the insurance companies between medical and mental health. And that is not happening. I'm sure you're very well aware of that. Right. So, I think, again, going to our elected officials, making noise, saying that we need this, we need our health insurance to cover us, for this. And I think, some of it comes down to medicine is a disease model. And it's more of that disease model versus like being, like proactive prior to. So you come in and your arm is all mangled like this. There's a problem. Okay, we can fix that. When you come in and you have functional depression and you're very social and smiling, with everyone, but you're not well, because let's say, you can do that in front of people, but you haven't been out of bed in 3 months and somebody had to drag you, to come to the doctor.
Right.
They can't see that. And I think that's, part of the issue is that it's a disease model, and you can't necessarily always see mental health, or you can't, like you said, see addiction physically before you. Now I want to get your input on this, because I had a conversation maybe a year ago with a president of one of the local healthcare systems, and I asked about a mental health inpatient, behavioral health unit again, I'm going to Monroe County is where I'm located, with, the PA Empowerment Network. I live here in Monroe County because we have several large healthcare systems in Monroe County now. And I asked if they were going to be the first to put in a behavioral health unit because there are none in Monroe County. And if you go to crisis and you need to be admitted, you're going wherever they have room. And what I was told was, again, it was the parity discussion that insurance doesn't pay the same for mental health than it does for medical health. And it requires more money because it's a little more specialized with like the nursing and things like that for a behavioral health unit, psych nurses and things like that, that the hospitals lose money. So I don't know if you've ever been told that.
That makes total sense. Just falling back on that idea that the same amount of money does not get dedicated for one thing versus another. Unfortunately, problems with money, that is part of the reality here. You have to hire more people. You have to have more psychiatrists, more therapists,
Right.
more nurses. You have to have more, and I'll tell you right now, Hope, and because I studied this extensively when the House bill passed a couple of years ago. We don't have a lack of nurses. We don't. We have a lack of nurses working as nurses. We
Right.
don't have a lack of techs, CNAs. We have a lack of CNAs and techs that want to get spit, bit, kicked, and hit because they're dealing with 40 patients for one CNA, because
Right.
you're dealing with 24 patients for one nurse. Nobody wants to be put in that. I mean, it's not that nurses don't want to be nurses. They just don't want to be put in unsafe situations for them, for their patients. It's a lose-lose situation. You have to be willing to fund this appropriately, and you have to be willing to hire the right amount of people. And when California, for example, with their nursing bill, when California in 1999 passed their nursing bill, people came from Idaho, Montana, Washington, Oregon, Nevada. They came in flocks, in droves to California. Why? Because they had a safe staffing ratio across the board. They had protection against whistleblowers. So if you were put in an unsafe position, you could talk about it, you could report this, and you couldn't get fired for this. There was things that were done to encourage nurses to come back to the bedside, and they can do the same thing here. They can do the same thing in mental health. It's not a lack of people that want to do it. I've seen hundreds of people just don't want to be in these environments that don't support them in any way. Whether that's, again, and you know what the worst thing is? The patients know it too. And the patients,
Right.
you see it in their eyes when they know that that nobody cares about them. It's not that nurse, they'll tell you that it's not that I think that you don't care, Scott. I know you care. The problem is there's one of you.
Right.
And there's 40 of us, and we need
right.
more
And they
of
do see
you.
it. You're right. Right.
And you
They do
can't
see it.
do that without hiring more people and without at some point saying, you know what? And then the worst part about this, back to what you were saying politically too, the worst part about this, in my opinion, the absolute worst part is I do think bipartisan, I think both sides of the aisle and independents all want the same thing. The question is, why are they not doing it? Why are they unwilling to do this? I don't think this is a case of we have different opinions here. I think everyone accepts mental health's a problem. I think everyone accepts these issues.
Right. Right. And we do have, a few legislators here in Pennsylvania that are working toward better mental health legislation. But I think, Scott, I think you and I could probably do a marathon podcast in talking with everything about mental health. I would love to have you back and forever
Absolutely.
and ever. And, every, I don't know, once a month, and we can just jam, verbally jam. But as we wrap up, is there just one thing that you think, like, what can we say to people not in my backyard? Just the one thing for our neighbors and our friends, just to get them to realize that, they need to be a little more welcoming to this in their community.
People who are battling mental health, people who are battling with addiction, people that are battling with anxiety disorders, any of these things, they need people. They need support. They need you to not be performative in your support. They need you to actually support them. They need you to go out and talk to your legislators, talk to your politicians, talk to people in your town. You know what? I think we do need these services. I think maybe we should try opening up this clinic. I think maybe we should allow these places to come in, because you know what? Compassion, empathy, these are things that are absolute. You can't recover. Nobody
Right.
recovers without these things.
Right.
Nobody's an island. It doesn't work that way. People need people, and they need help, and they need support. The performative stuff is wonderful. It's it's not about it's not about wearing a rainbow shirt and claiming that you support pride. Go out and do something about it. Go out
Right.
and actually make a difference. That's what we can do. That's what people can do. People have that voice. The
Right.
same voices are blocking these things. These people can do it.
Right. Well, that's awesome. I mean, it's always such a pleasure talking with you. You're so very passionate, and we
Always
will
hope.
come. We will come back again, and we will visit other, mental health, addiction topics. I so appreciate you, Scott, and thank you for coming on the show with me tonight. We're gonna definitely get you on the schedule on a regular basis. But real quick
Thank you.
before we head off, I just wanted to let everyone know that next week we're doing an update. I don't know if our followers remember that we met with the family of Melinda Hoagland. The organization they started is called Justice for Melinda. Their sister was killed by the hands of their father and his girlfriend. So it's been a little over a year. And we're going to kind of catch up with them, see where they're at, and then also see how they're doing in their mental health. So again, thank you, Scott Reese, RN, for your great insights today. This is Mental Health Mondays with Hope. Please check out all of our programs on the PA Empowerment Network, and don't just watch them, give them a like. Thanks, everybody. See you next week.